Welcome back to the second half of All About Money. Well, according to the International Agency for Research on Cancer, the world will see 21.7 million new cancer cases and 30 million cancer deaths in the near future, simply due to the growth and aging of the population. While that's a terrifying metric, it also means there's room for more smart technology in cancer therapies. So how will Internet of Things and artificial intelligence transform the global healthcare industry? Still with us is Rob Royea, Cyrcadia Asia CEO. Rob, in the first half of the program, we talked a little bit about your product, iTBra, and your company, Cyrcadia. And I know that you chose Hong Kong and here in Asia as the first market that you will launch your product. Can you tell us why Hong Kong, why Asia? What kind of challenges are we facing here?
Yeah, we really see Hong Kong as ground zero for breast cancer screening. Because of the density issue, there's over 60% of the female population have the condition of density, which creates a faster case of cancer many times, a higher propensity for cancer. And unfortunately, the current diagnostic modalities are really challenged with dense tissue. It's much like a snowflake in the snowstorm. So this population is key to be able to have another technology that can overlay on what's currently being done today to help to actually identify whether or not this person has cancer. Up to 70% of the biopsies we're seeing here in Hong Kong are on non-cancerous tissue. We're finding cancers earlier. 85% of women here are getting cancer without a history of breast cancer. Isn't that shocking? Shocking, right? Under age 40, 14% of the population of cancers in total are coming under the age of 40. Much too young, a condition that's really not being addressed by the current technologies today, and screening is really low, less than 30% of the population. So those are some of the reasons. I have other ones I can share with you.
What does it mean by having dense breasts, and what kind of challenges can they add to breast cancer screening?
Well, when we think about imaging, imaging has to be able to see through something to find something different. So much like a snowflake in a snowstorm is really what a physician has to go through to find a cancer in high density tissue. So for that reason, it's very difficult to find cancers behind all of that density. So the physician really has to do a great deal of interrogation, maybe ultrasound as well, a little bit better, but still a high degree of this false biopsies on non-cancerous tissue because of that.
Mm-hmm. So in terms of your iTBra, your product, it's very exciting, obviously, but have you gotten the approval to roll out in Hong Kong yet?
Yes, we have an FDA clearance in the United States, but we also allow ourselves then coming into Hong Kong on the current regulations, which frankly there isn't a great deal of regulation, but we're applying for whatever is necessary as new regulations are coming into place. So we're ensuring ourselves to be here even before the regulations come into place for Hong Kong.
Mm-hmm. So Hong Kong is almost ready to go. Right. Do you have approval to launch in anywhere else in Asia? Where are you going to launch next?
Yeah, so we're going to be launching almost simultaneously with Thailand and Taiwan. We'll then come through Japan, Australasia, all down to Australia, and then to China as well. Europe will follow once the product is released and we get something called a CE mark in Europe.
Mm-hmm. So in terms of an exact date, when can we see the first iTBra out in Hong Kong and in Thailand, like you just mentioned?
The first iTBra will be used by physicians by the beginning of January of 2019, so just a few months away. The open public will be able to start purchasing the product more in the middle to end of 2019. We want to make sure that we are getting the physician public or the physician market in place, and that they are prescribing for women who start to get comfortable utilizing the technology.
I know that you're also having a busy time preparing and trying to raise a Series A. How is that going for your team?
Yeah, great question. We just closed our seed round, so we're very pleased that the lead came out of iFlyTech in China, a very smart company in the area of artificial intelligence. That then sets us up for what is our A round that we're just opening up now. So a number of interested parties, some that were looking at us in the what we call pre-A round, are also looking at us now in this current $15 million raise going forward.
So who are your investors and what kind of initial reactions did you get when you first pitched them iTBra?
Yeah, so the investors, one of which we spoke about is iFlyTech, which is one of the largest companies doing facial and voice recognition in China, but also very deep into artificial intelligence and smart hospitals. So what they like about what we do is our ability to continue to product our evolution so that we can look at how we can take these very difficult to image mammography and ultrasound data sets and combine them with our metabolics. So what we're doing is we're testing over time, and physicians as well as the investors are interested in seeing the difference of metabolic tracing versus having to wait for imaging. We even have investors that are physicians here in Hong Kong.
Nice. So do you have any plans launching iTBra in China? Because one of the challenges in China is that most of the users, they might need to be more educated about the product and the whole breast cancer issue before they realize the challenges and how alarming the issues are. So what's your plan on that?
Yeah, so we have some of the top oncologists and private hospital groups in China that are awaiting our ability to release a product for them to start doing testing. We know it's very important that the physician community comes into play. But then we're also speaking to some of the largest providers of healthcare throughout China to help us to accelerate into the Chinese market. Also being here in Hong Kong, it's a bit of a portal, obviously, to the China residents. So they'll get a feel for what we're doing in 2019 as we're releasing here in Hong Kong. So we would expect that once we get through all the regulatory processes, we should be into China by late 2019 or early 2020.
So the technology and things that Cyrcadia is doing, they have already been in place before you joined the company. So can you tell us why you decided to join this company? Like, why did you jump in on this venture?
Yeah, the major difference that I see is that the world has really been dependent upon imaging. And when this company came to me and said, can you help us to monetize this and more importantly, get this to mass scale and to women? The major difference is that we were shifting the ability to just be late stage or in the clinic and hospital to really pivoting that to the general population to what we call population health, where women have the ability to screen early, we find cancers early, and then we have the ability to obviously offset late stage diagnosis and have a better outcome for life. So I saw this as a technology that could really make that happen, and our clinical pilots have shown that that actually is the case.
Mm-hmm. But this is a question for you, Rob. You as a man, why did you decide to dedicate your time in working on breast cancer?
Not only did I dedicate my time, I moved to Hong Kong to ensure that it could happen effectively. As a man, I'm actually part of a family. And my family is my wife and my children, our aunts and female relatives. In our family in particular, we have had 4 breast cancer cases diagnosed. It happens to every family. So as a man, you're a member of making sure that we have a solid family function moving forward. As a business person, I saw this as the ability to really help families to have a better longevity of life and to help to find cancers earlier. So from my perspective, be it a man or a woman, it's our responsibility. And now we're in October, think pink, right? Every time we say think pink, it's great to be able to go out and enjoy what we do on some of the, the stages and the celebrations of what happens to make sure that we're encouraging other people to help breast cancer. But I really challenge the world to say, every time we hear think pink, let's ask that woman next to us, will you please do your own breast self-exam? Please. Mm-hmm. Every time I hear it this month, I'm asking the same thing. So I'm asking you now.
Yeah, I'll make sure I'll do that. But in terms of, since iTBra adopted the technology of Internet of Things and artificial intelligence, do you see these technologies being able to help with other health issues?
Yes, we know that the same metabolic change we're seeing in breast can actually apply to different parts of the body, both for female and male. So, but the first thing is breast cancer is the #1 cancer for women. Let's really focus on that. Let's ensure that we take care of that, and then we'll move on to other areas of cancer that we know can be addressed.
So are there any notable health issues that Cyrcadia might be working on in the near term?
Our interest level goes beyond just diagnosis and into therapeutics. So we do know that circadian patterns and changes is what we're detecting now can actually go all the way through into the area of therapeutics. So we're working with some of the leading hospitals here that already have a background in studying in that technology. So we are here to help actually the full continuum of care. We also know that once a woman experiences chemotherapy, that their chemo does affect, and the surgeries does affect their circadian patterns. So we're really focusing on how do we ensure that at the end of the process, we can try to stop the reoccurrence of breast cancer as much as possible through understanding of metabolic change.
So in terms of the current global healthcare industry, do you still see any weaknesses where technology can come to the rescue?
I clearly see artificial intelligence as being a friend of the medical industry. I think sometimes there's some concern about that. But the reality is that when we can start making sense about large data sets, the ability to make sense about how we make a diagnosis and keep that knowledge base in a large cloud, that then we can do very smart, very intelligent decision processes around that, it's really important. Also, the ability to think about how we look at the patient profile and how the patients are coming in and out of the institutions. Very few physicians for a mass population. How do we ensure that when women and men are coming into the institutions, that we have a better outcome by patient selection and knowing how to route that patient appropriately?
Rob, thank you very much for your time today. That was Rob Royea, Cyrcadia Asia CEO. This is it from this edition of All About Money. We'll be back right here on HKIBC next Sunday. Good night.